Good morning, guys. Welcome to day 3 of Unit 4, Week 7. We have been focused on research question number 6 this week. Today, we're going to take a little break from focusing on just the research part, and we're going to talk about something new to help make our writing even better, and that is called technical language. So, accurate use of technical language is one way authors convince readers to trust their opinions. So let's think about everyday language, everyday words that are familiar to almost everyone because they are used in speech regularly, okay? And anybody can use them, right? I might talk about lunch. You're also going to talk about lunch. Doctors are going to need to use the word lunch, right? Because that's something that we all kind of have in common. It's not specific to just one person. Whereas technical vocabulary are words that are used mostly in specific content area. So authors use technical language to demonstrate expertise and improve clarity. Clarity is making it easier for readers to understand and follow their thinking. So I want to do a little read aloud for you guys. I'm going to read from a book on the ARC bookshelf called Doctors. And I want you to be thinking about what technical language you see the author using. Afterwards, I'm going to make a list, and you might catch some things that maybe I didn't catch or I don't remember, okay? So I'm going to go over here, and I'm going to look at the table of contents first. And I know that I can read a couple of these chapters, but I don't need to read them all. Obviously, I don't need to really read about how to become a doctor, where doctors work. We kind of already know a little bit about that, right? Famous doctors. So I'm going to read these first 3 chapters, okay? So the first one is, what is a doctor? Ouch! A boy falls. He cannot walk on his leg. It hurts too much. He goes to the doctor. The doctor checks the leg. He finds out the boy has a broken bone. The boy will wear a covering on his leg. It will keep the bone in place. Then the bone can heal. Doctors help people who are sick, or doctors help people who are hurt. They help people who are sick. Doctors also help people stay healthy. The people who go to a doctor are called patients. Types of doctors. There are many kinds of doctors. Some help only babies and kids. You might go to one of these doctors when you get sick. You might also go to one for a checkup. At this visit, the doctor will make sure you are healthy and growing well. People of all ages go to family doctors. These doctors help people with many health problems. They give checkups too. Other doctors give different care. Some help people with heart problems. Others help people with skin problems. Some doctors are trained to cut open the body. They are called surgeons. These doctors fix broken bones or body parts that are not healthy. What do doctors do? When you go to a doctor, you might see a nurse first. Doctors and nurses care for people together. Nurses check a person's height and weight. They do other tests too. All the information gets saved in records. The doctor looks at the records. Nurses and doctors talk about the information. Next, the doctor checks the person's body. Before starting, a doctor might put on gloves. He or she might also wear a face mask. Gloves and masks can help keep people from getting sick. A doctor might wear a white coat too. It can help keep the doctor's other clothes clean. Doctors use many tools. They use a stethoscope. This tool lets the doctor hear a person's heartbeat and breathing. Doctors also use tools to look closely at body parts. They see inside the ears, nose, and throat with an otoscope. Doctors use a different tool to check the eyes. Doctors tap the knee with a rubber hammer. They see if the leg kicks up. This kick happens on its own. This test shows that the brain is working with the body like it should. Here's some examples of doctors' tools. Sometimes people have signs of sickness. These signs are called symptoms. For example, a person's throat or ears might hurt. A person might have red bumps on his or her skin. The doctor tries to find what is causing the symptoms. The doctor may need to get blood or other samples. Lab workers look closely at the samples. The doctor checks what they find. Doctors also ask questions to learn more. They may ask what a person usually eats. They might ask if people in the person's family have health problems. Doctors may need to talk to other doctors. Doctors think about everything they learned. Often there's more than one way to explain the signs of sickness. Doctors decide which cause is most likely. After finding a cause, a doctor tells the patient what it is. The doctor also says what treatments might help with the symptoms. This helps patients know how to get healthy. Sometimes small changes help. These include getting more sleep or eating different foods. Other times, doctors say taking medicine such as pills can help. Sometimes people need surgery. All right, I heard some great examples of technical language in there. So I want to make a list of some technical language that I heard. Okay, so I heard the word symptoms. I heard stethoscope. Oop, I added too many T's. I heard the otoscope. Remember, they check your ears, your nose, and throat with that. I heard patient. I heard labs. I heard records. Let's see, what else did I hear that I could say was a good example of some technical language? Let's see, we heard the word checkup. That's specific to doctors, right? Let's see, we also heard, I'm trying to think of what else. I think that might be it. You might have remember some that I didn't remember, and that's great. So if we look at these examples of technical language, we notice that these are all specific to people who work in the medical field. It might not just be doctors that are going to use this, okay? Also nurses, maybe firemen might use it because a lot of times they arrive first to the scene and they may need to help somebody as well as EMTs. Now, would a teacher necessarily use a stethoscope or otoscope? No, right? Would a librarian refer to the people who come to the library as a patient? No. So that's why it's specific to people who work in the medical field and more specifically to doctors, right? Doctors have patients. There's labs, there's records, there's checkups. So these words are geared to doctors, nurses, and other people in our medical field. All right, I also want to go over concluding statements with you guys. So if I was to state my opinion about the book we just read, I could say, I think doctors use many tools to perform their job. So let's think about that as my opinion. Now let's look at concluding statements. So a conclusion. In a conclusion, your goal is to wrap up your opinion, including restating your topic and why it is important, restating your opinion, reminding readers why they should agree with your position, and calling for action. So I could make a concluding statement based off my opinion by saying, as you can see, doctors require many tools to complete their jobs. So I am restating my opinion, right? And there's some different phrases, and we'll go over that in just a minute because I also want to look at our linking language, and I want to talk about the different phrases that you could use. So right down here on the linking language, you go down to where it says conclude, and it gives you some good phrases that you can use to start off your concluding statement. You could say summing up, to conclude, in conclusion, this shows, and after all. Or you could say, like I said, as you can see. So these phrases help indicate that you are wrapping up what you just wrote about. So you're concluding it. So when you're writing it, I want you to come to this chart and I want you to think about using some of these phrases to do your concluding statement tomorrow on your draft. All right, next thing I want to review before we do our writing tomorrow is sufficient and insufficient reasons or evidence, okay? So we've talked about this before. Sufficient reasons or evidence, providing enough reasons or evidence to convince your audience to agree with your opinion, providing evidence to support all parts of your opinion. Insufficient reasons or evidence, providing very few supporting reasons or failing to provide supporting reasons for one part of your opinion. And then images could also be used. They are used to enhance or clarify information in a text, okay? They could be graphs, drawn pictures, photographs, timelines, maps, charts, just like we saw that kind of that picture, that illustration of all the different doctors' tools in the book we just read about. So let's look at a good example, okay? So here's my opinion is down here at the bottom. It says, I think dentists are caring and explain things well to people. Let's look at the chart. So reasons and evidence that support that. Dentists keep us safe. Dentists teach us how to keep our teeth clean so we don't get cavities. Dentists tell us if anything is wrong with our teeth. All three of these things are facts. All three of these things also support that dentists are caring and that they explain things well to people, okay? And if we look at the other side, the reasons or evidence that doesn't support it. Dentists see about 20 patients a day. Does that tell me that dentists are caring? Does that show me how they explain things? No. Dentists' offices are crowded. Does that show me that they're caring or that they explain things well? No. Dentists use many tools. That also does not show that they are caring or that they explain things well. So we want to go back and we want to make sure our reasons support our opinion, okay? Not just maybe interesting things we might have read throughout our story. We want to be able to support the opinion. That's what we're working on in this unit. All right, guys, I will see you tomorrow.